If you look at the spine from the side, you will notice it is not straight. It has three curvatures, which are normal and important for mobility and shock absorption. However, when viewed from behind, the spine should appear straight. If the spine appears curved when viewed from behind, this is referred to as scoliosis. In 80% of scoliosis cases, there is no clear cause, but it is more commonly associated with adolescence, usually between ages 10 and 15. Scoliosis is significant as it affects around 2 to 3% of the world's population, equating to hundreds of millions of people. It is important because, depending on its severity, it can impact quality of life and, in severe cases, affect lung and heart functioning. The most obvious sign of scoliosis is an abnormal curvature of the spine. When viewed from the back, the spine may appear curved to one side, forming a C or S shape, instead of running straight down the middle of the back. The second most common sign is one shoulder appearing higher than the other, or one hip being more prominent. The condition is considered more than mild if the Cobb angle measurement exceeds 25 degrees. In more severe cases, back pain and discomfort are common, as the abnormal spinal alignment puts disproportionate pressure on muscles and nerves. In very severe cases, spinal curvature can compress the lungs, causing respiratory difficulties. However, visual deformity or curvature is not always visible, especially in mild cases. Unnoticed cases account for about 30%, but in most instances, scoliosis is still accessible visually. Another misconception is that scoliosis is caused by poor posture or carrying heavy loads. This is untrue, as most scoliosis cases are idiopathic with no strong correlation to environmental factors. However, poor posture can exacerbate existing scoliosis and worsen symptoms. There is no exercise that can cure scoliosis, and no non-surgical cure exists, but exercise is vital for improving quality of life and symptoms. It cannot correct curvature, though. Fortunately, not all scoliosis cases require surgical treatment. In mild cases, observation is the first line of treatment. If it's moderate, 20 to 40 degrees, bracing is used, especially among adolescents. The brace cannot correct the curve, but can prevent further progression, especially while the child is still growing. The most commonly used brace is the Boston brace. Surgical intervention is considered if the curvature is 40 to 45 degrees. Regarding exercises that are beneficial for scoliosis, the top 3 exercises to do at home include supine pelvic tilts. This improves posture and supports the spine. Lie on your back with your knees bent and feet flat on the floor. Place your hands lightly on your abdomen. Slowly tilt your pelvis upward, hold for a few seconds, and repeat 10 to 15 times. Bird dog exercise. This improves core strength. Start on your hands and knees with your hands directly under your shoulders and knees under your hips. Extend your right arm forward and your left leg backward, keeping your back flat and core engaged. Hold for a few seconds, then return to the starting position. Repeat on the other side, doing 10 to 15 repetitions per side. Plank. This helps core muscles, improving posture and supporting the spine. Start in a push-up position with your hands directly under your shoulders and your body in a straight line from head to heels. Engage your core, hold for a few seconds, and repeat 10 to 15 times.